everyone, my name is Kirti and I'm from Kirti Institute, and in this video I'm going to drive you through an occupational English test. So this video is for the beginners who wants to learn about occupational English test format. So let's get started. Let us see what exactly OET stands for. OET is for an occupational English test. So I'm going to orient you with this test. Occupational English test is specifically designed for healthcare professionals who wish to work or study in an English-speaking environment. This test results acts as a proof of your ability to communicate effectively in demanding healthcare settings. OET is trusted and recognized by regulators, hospitals, universities in following countries as a proof of ability to communicate effectively. So here are 9 countries: the UK, the USA, Ireland, Australia, New Zealand, Ukraine, Singapore, Dubai, Namibia. More countries are joining in this list, like Canada has started accepting OET for doctors to understand as a proof of ability. Malta is another country for nurses who are accepting OET as a language test. That means the test demand has been increasing day by day. Who can apply for the test? There are 12 professions who can apply for OET, and they all are healthcare professions. As you know that this test is for healthcare professionals. So these 12 are specialties like nursing, medicine, dentistry, dietetics, occupational therapist, optometrist, pharmacist, physiotherapist, podiatrist, radiographer, speech pathologist, and veterinary scientist. Why you need to do so? Why you need to know that these are 12 professions? There are 2 main reasons. First of all, listening and reading are same for all these 12 professions. And if in future someone asks you that I'm optometrist, can I take OET? You must have the answer, right? So let's move to the next slide. There are 4 subtests: listening, reading, writing, and speaking. These all are basic skills to learn a language. Listening in OET assesses your ability to understand and follow a range of health-related spoken material, such as patient consultation and lectures. Reading assesses your ability to read and understand different types of texts on health-related subjects. Writing assesses your ability to write a letter in a clear and accurate way which is relevant for the reader. At last, speaking assesses your ability to effectively communicate in a real-life context through the use of role plays. Now, let's see each subtest in detail. Listening has 3 parts: Part A, B, and C. Part A takes 15 minutes, where you will have to fill in the gaps. There will be 2 patient-led dialogues. That means there will be a consultation between a patient and a doctor. In Part B, you will have 6 dialogues or monologues, and you will have 3 answer options. It will take 10 minutes. Part C contains 2 long presentations or interviews with healthcare professionals. You will have 12 questions with 3 answer options, and this will take 15 minutes. Let's see each part in detail. Listening Part A, as you can see on the screen, there will be 12 blanks. Here, you will be briefed about who is going to talk to whom. Like obstetrician is going to talk to the patient Melissa. So you can understand that this will be a consultation between obstetrician and a patient. Then you will be given 30 seconds to go through all 12 blanks and possibly predict your answers. Then the audio will be played and you will have to write your answers as you listen. Make sure the audio will be played once only and you do not have any separate answer sheet to transfer your answers. You will have to write on question paper itself. Then there will be extract 2 with another 12 blanks. That means in part A, you will have 12 plus 12, total 24 blanks. Before each extract, you will be given 30 seconds to prepare for your answers, and then the audio will be played. Let us see part B of listening. There will be 6 short dialogues. As you can see on the screen, here are 3 questions. Another 3 questions, that means total 6 questions will be there with 3 answer options. Before each question, you will be given 15 seconds to read the question prompt and 3 answer options. Then the audio will be played for a particular question, and at the end of the audio, you will be given 5 seconds to share your answer. That means out of these 3 options, whichever option you feel correct, that circle needs to be filled up. Make sure listening part B and C are computerized assessed. So you will have to fill in the circle in a manner that the computer will accept it. Such 6 questions are there. Before each question, you will be given 15 seconds. And believe me, these 15 seconds are more than enough to prepare for your question. Then the audio will be played and you will have to give answer within 5 seconds. Once the audio starts, you do not have time to rethink. So listen to your conversation very carefully. I hope you are clear with part B. I'm moving to part C. Part C will have 6 questions with 3 answer options. Before each extract, you will be given 90 seconds to prepare for your 6 questions. Then the audio will be played for extract 1, and you will have to give the answers simultaneously. Make sure there is no any gap between the questions. In part B, you used to have gap of 5 seconds that was helping you to understand where the conversation is going on. Whereas for part C, there is no any gap between any question, so you will need to keep moving along with the audio. At the end of 6 questions, the audio will guide you that now this is time for extract 2. Then you will be given 90 seconds to prepare for next set of questions. Then the audio will be played and you will have to give your answers simultaneously. At the end of the listening, you will be given 2 minutes to make any changes in any parts if required. Make sure this format is for OET paper-based test. Now, let us summarize what is there in listening OET. Part A is divided into 2 extracts, 12 plus 12, total 24 blanks. Before each extract, you will be given 30 seconds to prepare for the task. Then the audio will be played and you will have to write your answers on question paper itself. In part B, you will have 6 questions with 3 answer options. Before each question, you will be given 15 seconds to prepare for the task. Then the audio will be played for that particular question and you will have 5 seconds to share your answer. The audio will clearly guide you for part B that now this is time for question number 26, question number 27. So there are no chances to getting lost. Listening part C has 2 extracts. In each extract, you will have 6 questions with 3 answer options. You will be given 90 seconds to prepare for each extract, and at the end of 90 seconds, the audio will be played and you will have to give the answers as you listen. At the end of the listening test, you will be given 2 minutes to make any changes if required. I hope it's clear. Now let's move towards OET reading. OET reading also has 3 parts, part A, B, and C. Part A will be there for 15 minutes. Make sure at the end of 15 minutes, part A will be taken back from you. That means after 15 minutes, you will not have time to go back to part A. Later, part B and C will be given to you together. that you will have to finish in 45 minutes. In part A, you will have 4 short texts, and it requires your ability of skimming and scanning. Part B has 6 short texts. It is for the reading of gist and purposes. Part C has 2 long texts, understanding comprehensive texts, infer meaning, and identifying points of views. Let us see each part in detail. As you can see on the screen here, you will have 4 short texts. There are 20 questions and 15 minutes. Does it sound difficult? Don't worry, it is not. The first type of question is matching the passage. That means you will be given a list of questions and you just have to identify that the question belongs to which text. You are not going to give the answer for that question, but you are just going to find the location. Okay, the question belongs to A, B, C, or D. That means your answer will be either A, B, C, or D for first set of question. Then short answer questions that will be like no more than 3 words. And then sentence completion, that is again fill in the gaps. I hope it is clear. Let's move to part B. You will have 6 short texts related to workplace. As you can see here, there will be a question, a box of information, and 3 answer options. You will have to read the question, read the given information, and you have to identify the correct option. You are not going to search here and there because with each question, you will be given the box of information. So for this question, you are going to find the information from this box only. So for all 6 questions, you are provided separate box of information with 3 answer options. The good thing is that out of 3 answer options, 1 is not at all given into your information. 1 will be giving the contrast information and 1 will be matching with your answer option. Right? Interesting? Yes, it is. Let's move to part C. There will be 2 long semi-academic medical texts of about 750 to 800 words. There will be 16 MCQs in total because part C is further divided into 2 extracts. In each extract, you will have 8 questions with 4 answer options. Make sure now there are 4 answer options. But don't get confused because 2 options you will be easily able to eliminate and remaining 2 will be damn confusing. You have to be aware of the tips and techniques to solve particular question. So in part C, you will have total 6 MCQs. Let's summarize what we learned in OET Reading. OET Reading part A will be there for 15 minutes. At the end of 15 minutes, part A will be taken back from you. You will have 4 short texts, 15 minutes and 20 questions. The types of questions are matching the passage, short answer question, and fill in the blanks. In reading part B, you will have 6 questions with 3 answer options with the separate box of information. You will have to read the question, read the passage, eliminate the wrong answer, and give your final answer. In reading part C, you will have 2 long semi-academic medical texts. That means part C is further divided into 2 extracts. And here you will have 8 questions with 4 answer options. There are no any separate, any additional timings. At the end of 45 minutes, part B and C will be taken back from you. I'm sure it's clear now. Let's move to my favorite, and that is writing subtest. Writing subtest is very deep study, I can say. Failure ratio of OET is quite higher in this writing subtest. The reason is that as an examiner, we are able to get opportunity to identify your level of English, right? Here we can understand how much you have learned English right from your childhood till now. So let's see what is there in OET writing. In OET writing, you will have to write a professional letter because you are going to write as a professional. If you are a nurse, you will write as a nurse. If you are a doctor, you will write as a doctor. And if you are a physiotherapist, you will write as a physiotherapist. That means you are taking your professional role. And that is why we have only one type of letter, that is professional formal letter. There are 4 types of letters, that is referral, transfer, discharge, information or advice letter. But for doctors and nurses, we have only 3 types of letters, and that is referral, transfer, and discharge. Referral means you are referring your patient for a specific purpose. For example, you are writing a letter to the endocrinologist for the treatment of unstable blood sugar level. Transfer letter is you are transferring your patient from one facility to another facility for a specific care. Discharge letter is like patient has recovered and getting discharged. But it also can be a transfer, like patient is getting discharged from your hospital, but maybe for another reason, patient is being transferred to another facility. So when there is a discharge letter, you will have to make sure whether it is the patient has completely recovered and getting discharged, or it's a transfer letter. You will be given a case note followed by writing task. During your studies, you must have done the case studies, right? While taking case studies, while doing the studies, you are taking the information from the patient, patient's personal information, patient's medical background, social background, past surgical history, patient's presenting complaints. Based on that, if you are a doctor, you will write a treatment plan for the patient. If you are a nurse, you will write a nursing care plan. Based on that, you provide the assessment and management or care and management to the patient. And lastly, you write a discharge summary. This kind of information will be given to you in a note forms. It will not be into full sentences. Okay, it depends on to whom you are writing. Based on that, you will have to select the appropriate information. That means if you are writing to the endocrinologist, you will have to select the information that is relevant for the endocrinologist. And based on your selected information, you will have to organize a clear, good, meaningful letter. You will be given 45 minutes. From that, initial 5 minutes is compulsory reading time. Then you may start writing. But if you want to learn how to utilize your time, you can see my video on how to manage time in OET writing. Let's see what will be there in speaking. It's quite interesting because this is what you are doing on day-to-day basis. As I said initially, listening and reading are same for all 12 professions, whereas writing and speaking are profession specific. That means in speaking, you will be taking your professional role. There will be simulated consultation between a patient or healthcare practitioner. Candidate takes his or her professional role and interlocutor takes a role of a patient, relatives, or carer. That means if you are a doctor, you will take a role of a doctor. If you are a nurse, you will take your professional role of a nurse. And if I'm practicing with you, I will be taking the role of an interlocutor. Make sure interlocutors are not your examiners. They are English teachers specifically trained for medical English. So you can take your interlocutor as your real patient. Don't think so that it's your interview. Just believe that you are going to talk to your real patient and make your interview lively. Let's see what all parts are there in OET speaking. It starts with ID check. Initially, interlocutor will make sure that you are the same person who has registered for the test. Then there will be a warm-up session, which is completely non-evaluatory. You are not going to be scored on the basis of warm-up. This is designed to make you comfortable with the interlocutor. While teaching English, I have seen many students who are being nervous before the test, are getting anxious related to the test. And that is only the reason because of which their score falls down. So this can be prevented here by knowing that the interlocutors are not your examiners. They are just like your real patients. At the end of warm-up session, you will be given a role play card first. In role play card, you will have the information about your setting, that means where you work, then patient's background information and certain tasks. OET is very interesting test because here you are already given what you are going to talk about. The list of tasks guides you to speak. There won't be any chance that you have no idea about what to speak because you are very carefully guided for your speaking. Okay, there will be simulated consultation. That means if you have a question, your patient will have answers. If your patient has question, you will have answer because your tasks and interlocutors, that means your patient's tasks, are synchronized. It is linked together. So it depends on you how you start the conversation, how you proceed, and how you help your patient to know more about their conditions. Or it depends on you how you approach to the patient's concerns. You will be given 3 minutes of preparation time for your role play. Then you will have to speak for 5 minutes. At the end of 5 minutes, your first role play card will be taken back from you, and then you will be offered another role play card. Again, the same process, you will have to prepare for 3 minutes, and then you will have to speak for 5 minutes. While speaking, you will be given paper and pencil if you want to make any notes. Before your 5 minutes of speaking time, if you have any doubt regarding your role play, you are free to ask to your interlocutor. Isn't it amazing? You can ask, how does it pronounced? I already met you earlier, or this is my first visit with you. Okay, so if you're unsure about anything, you may ask to your interlocutor, right? And at the end of this second role play, the best line would be there. This is the end of your OET test for which you will be waiting. I hope you understood about OET test format. If you have any question, please do not hesitate to write down into the comment box. I'll be there to answer you. Thank you so much.